Hello, listeners. You're welcome to another episode of Advocating for Specially Abled Children. My name is Oluwaseyi Obasa, and I am your host on this radio program put together by Amo Gates Radio Communications. Today, we'll be looking at ASD, Autism Spectrum Disorder, which is a neurological and developmental disorder that affects how people interact with others, communicate, learn, and behave. Although autism can be diagnosed at any age, it is described as a developmental disorder because symptoms generally appear in the first 2 years of life. Autism spectrum disorder is a condition related to the brain development that impacts how a person perceives and socializes with others, causing problems in social interaction and communication. The disorder also includes limited and repetitive pattern of behavior. The term spectrum in autism spectrum disorder refers to a wide range of symptoms and severity, and this makes autism a condition that were previously considered separate. So initially it used to be considered in different separate ways. So it had, just like now that it has been broken down into the high functioning, the mild functioning, and the low functioning, then it used to be called autism, Asperger's syndrome, and childhood disintegrative disorder. And then we also had some people call it an unspecified form of perversive developmental disorder. Some people still use the term Asperger's syndrome, which is generally thought to be the mild end of autism spectrum disorder. Autism spectrum disorder begins in early childhood and eventually causes problems functioning in society, socially in school and at work. For example, often children show symptoms of autism within the first year. A small number of children appear to develop normally in the first year and then go through some period of regression between ages 18 months and 24 months when they develop autism symptoms. So you'll hear some parents tell you, my child was normal at a certain age, and until my child became 2, I started observing some things. Yes, autism can stay till 2 years before it starts showing some symptoms. Now, it's very important for us to know that autism is not an illness. Autism is not an illness. It is not a disease. It just simply means that your brain works in a different way from others. It's something that one is born with, and signs of autism may not be noticed when you are very young. Some people don't notice the symptoms until they are older. And then it's important to know that there is no cure for autism. When you have autism, you have autism your whole life. Autism is not a medical condition with treatment or cure, but support is needed to help that person pull through their daily living. Now, because one is autistic does not mean that one cannot live a fulfilled life. Yes, one can. We have quite a lot of people in the industry, in different industries that have lived a fulfilled and impactful life. We have the likes of Leonardo da Vinci, a very popular painter in his time. We have people in the sports industry that have autism and have lived a normal life, a fulfilling life. In the movie industry that have lived a fulfilled life and are still living a fulfilling life though. So we have them in different spaces and they are doing great. We have them as doctors, not medical doctors, honorary doctors. We have them as achievers in the industry. So living with autism does not mean that one cannot live a fulfilled life. It is not clear what causes autism though, but what is important that we know that nobody knows what causes autism. It can affect people in the same family, so it may sometimes be passed on to a child onto a child by the parent. So if the parent has symptoms of autism, there is a likelihood that the child might eventually have autism. What autism is not is that autism is not caused by bad parenting. So some parents might look at it and think they have been careless at a point or something. Bad parenting does not cause autism. Vaccines does not cause autism. Taking vaccines does not cause autism. Autism is not linked to diet, and it is not an infection that can be spread from one person to the other. Now, it's also important that we know that autism comes with comorbidities. Comorbidities can be referred to as strings of other challenges, other neurological disorder or learning disabilities that can, come with that spectrum. So we have some of them as ADHD, attention deficit hyperactivity disorders. This was what we discussed in the last edition. We have dyslexia, which is a learning disability. We have anxiety. We have depression. We have epilepsy. We have Salvant syndrome. We have Down syndrome. We have Fragile X syndrome, and many others. Many other conditions that come with autism. So statistics has it that at least one out of 36 children has been identified with autism spectrum disorder. This research was made by the CDC, the Center for Disease Control. The same research was made by ADDM, the Autism and Developmental Disability Monitoring Network. About 1 in 6 children, that's about 17%, within the ages of 6 to 17 were diagnosed of developmental disabilities as reported by parents during a study period of 2009 to 2017. These disabilities included autism spectrum disorder, attention deficit hyperactivity disorder, blindness, cerebral palsy, and amongst others, much more. What are the symptoms? What are the signs we can look out for to identify a child with autism spectrum disorder? So it's important you note that not all the signs will be seen in a child. You can have about 2, 3, or more signs, in a particular child or in other children. Some children show signs of autism spectrum disorder early in infancy. Such signs are reduced eye contact, lack of response to their names, or indifference to caregivers. Other children may develop normally for the first few months of their years, but then suddenly become withdrawn or aggressive or lose language skills they have already acquired. So some of these signs can be seen by the age of 2. Each child with autism spectrum disorder is likely to have a unique pattern behavior and a level of severity from low functioning to high functioning autism. Some children with autism spectrum disorder have difficulty learning, and some have signs of lower than normal intelligence. Other children with the disorder have normal to high intelligence. They learn quickly, but they have trouble communicating and applying these things they have learned to their early day life. And they also have challenges adjusting to social situations. And so because of the unique mixture of symptoms in each child, severity can sometimes be difficult to determine. It's generally based on the level of impairment and how they impact the ability to function. So here are some of the signs that you can come across. Like I said earlier, you might find 1, 2 or more signs in the children, but as soon as you start seeing the signs, it's important you take your child to a pediatric developmental doctor to check and do proper diagnosis. Now, because you are seeing the sign does not mean that you are able to do diagnosis for these children. So it's important you do a proper check with a pediatric developmental doctor. So here are some of the signs you can see in the children. 1, failure to respond to his or her name or appear to hear you at times. So when you call that child and that child seems to be looking somewhere else and not responding to you, it is a sign. Poor eye contact and lack of facial expression. So these children, you will find out they don't smile, they don't cry, they don't look surprised, they don't, some of them are even injurious. Some of them, so it depends on the level of functioning that child has. Some children might be doing things that are injurious to themselves and not feel that they are injurious. Some cross the road without even taking cognizance to the fact that vehicles are passing, or some could prick their legs on stones or bottles and not even feel the pain. So they lack expression in so many ways. They don't speak, or they have delayed speech, or they lose their previous ability to say words or sentences. Children living with autism cannot start a conversation or keep on going, or only start one to make requests or label items. So please watch out for these signs. They speak with an abnormal tone, or rhythm. They speak with an abnormal tone or rhythm and may use a sing-song voice or a robot-like speech. So they sound like cartoon characters. Sometimes you will think they are mimicking cartoon characters, but that is how they make their conversations. Their voices don't come out the normal way they should. They repeat words and phrases verbatim. We call that echolalia, but they don't understand how to use them. So when you say good morning, they will tell you good morning Tolu, good morning Tolu, good morning Tolu, good morning Tolu, how are you Tolu, how are you Tolu. So they do echolalia. That's what we call it, echolalia. Children living with autism don't appear to understand simple questions and directions. So when you give them instruction, they don't understand, they don't follow through rules, they don't express emotions or feelings, or they don't appear to be, they appear to be unaware of other people's feelings. So when you as a parent is not impressed, when you are sad, or when you are happy, they don't know how to make happy faces, they don't know how to make sad faces, they don't know how to express anger, and even when you are expressing it, they are not seeing it. Children living with autism don't point at or bring objects to share interest. They are not socially inclined to do such. They have inappropriate approaches towards conversations. So it's either they are disruptive, or they are aggressive, or they are passive. Children living with autism have difficulty recognizing non-verbal cues such as interpreting other people's facial expression, body posture, voice tone. They also have patterns of behavior So I'll just quickly go through this. They have patterns of behavior such as rocking, so they are moving forward and backward, or they are spinning, or they are hand flapping, they perform activities that could cause self-harm. So like I said earlier, it depends on the level, the functioning level. For children with high functioning autism, it depends on their functioning level. Some of them bite, some of them bang their heads. You hear them screaming, Children living with autism develop specific routine or rituals that become disturbed at the slight change. So when you are trying to modify that behavior, it becomes a challenge for you. They become aggressive, they become pained, they become, they show it through aggression. They scream, because it's a routine for them and they don't want it changed. Children living with autism have problems with coordination or odd coordination, or they have odd movement patterns such as clumsiness, walking on toes, stiff or exaggerated body language. Children living with autism are fascinated by details of an object, such as spinning wheels of a toy car. Most especially for the girls, they like their dolls with the rough hair, but this doesn't, but they don't understand the overall purpose or function of that object. So whether the object is broken in the face or is broken in the arm, they probably like it like that, and they don't understand what that object particularly is used for. Children living with autism are sensitive to light, sound, touch. So when you turn on the lights, they freak out. They close their ears at sounds. You see them using both hands to close their ears at sounds. And the moment you want to touch, they pull back. They tend to pull back. In spite of this, they are still very indifferent to pain and temperature. Children living with autism don't engage in imitative or make-believe play. So they cannot play, I am a doctor. They cannot play, I am mommy. They cannot play, I am a teacher. They can't even initiate play, let alone do make-believe play. They are fixated to an object with abnormal intensity or focus. So they are looking at one object in such a way that you will feel like there is something else attached to that object. Okay, so children living with autism have specific food preference, such as eating only a few food or refusing food with a certain texture. So you get some of them telling you that they can't eat chewables, hard food. They only want to swallow. The moment you put it in their mouth, they want to gulp it in. As they mature, some children with autism become more engaged with others and show fewer disturbances in behavior. Some, usually those with less severe problems, eventually may lead normal or near normal lives. Others, however, continue to have difficulty with language and social skills, and the teenage years can bring worse behavioral and emotional problems. So when is it necessary to see a doctor? 1, when your baby is not blabbing at 12 months, when your baby is not responding to smiles or facial expressions or happy expressions at 6 months, when your baby is not mimicking sounds or facial expression at 9 months, when your baby does not gesture, such as pointing or waving hands at 14 months, when your baby does not say single words at 16 months, when your baby does not play make-believe or pretense at 18 months, when your baby does not say 2-word phrases at 24 months, when your child loses language skill or social skill at any age. it is very important to be observant enough to take these children to see a pediatric developmental doctor to do proper tests and diagnosis. And after all this said and done, they would recommend that you see a therapist in different in the diverse ways that your children might need. So you might need a speech therapist, and you might need a behavioral therapist. So it's important that we take note of these symptoms and these signs to be able to know when to bring your child to see a pediatric developmental doctor. So on this note, I would want to say thank you to all that have been a part of this program. I want you to believe in yourself that you can help your children through this process. Like I said earlier, it doesn't have a cure, but with enough support and love, these children can come around to lead a near normal or a normal life again. On this note, I would want to say thank you and see you in the next edition coming up next week. Have a pleasant week, fulfilled and beautiful week ahead. Thank you.